Hello and welcome to the Think Global Forum Roundtable. AI and healthcare, the good, the bad, and maybe a little bit about the unknown. My name is Simon Hodgkins. I'm the founder and host here at the Think Global Forum. And today I'm joined by a real expert panel for this important topic. I'd like to thank them for their time today, and also a special thank you to everyone who's joining us today live from around the world. And of course, for anybody who's catching up with the recording after today's live discussion. Thank you very much for your support of Think Global Forum. Let me get into it. I want to do a quick introduction to our expert panel. First up, we have María Mateos. María is focused on, I suppose I'm right in saying, María, accurate, high quality solutions, localization, and everything to do with global content solutions across a wide portfolio. Medical devices, healthcare software, clinical trials, biotech, mental health, med tech, pharmaceutical, and everything to do with pure and applied science. So María, you're very welcome to the panel.
Thank you, Simon. I'm delighted to be here. It's a pleasure to be part of this amazing panel and discussing one of the most fascinating topics these days.
It's a hot topic, that's for sure. You're very welcome, María. Next, I want to introduce Jamie Whysall. Jamie, the head of health for Netcompany. And Netcompany, it's a leading pan-European organization. It's got over 8,000 or 9,000 skilled people around the world, operates in about 10 countries, or if not more at this stage, Jamie, founded in Copenhagen. And it helps both public and private sector customers accelerating this, what can be ambitious and, dare I say, complex, Jamie, digital transformation journeys, AI certainly being part of that story. And I know, Jamie, you work closely with the entire health ecosystem, from national bodies, which are part of the landscape I'm sure we'll touch on today, through to local trusts, ICBs, and of course, primary care and health tech. So Jamie, thanks for joining us today. It's great to have you on the panel.
You're very welcome. Thank you very much for inviting us to be here, Simon.
It's our pleasure. And last but not least, I've got to introduce Dr. GPT, also known as Dr. Harvey Castro. Look, what can I say about Dr. Harvey? He's got over 2 decades and climbing experience. He's a physician, an entrepreneur, a CEO. I know he's got 8 freestanding ERs, medical billing, physician staffing companies, and he's become a real driving force for change. I don't know how many live TV appearances at this stage, but it's in the hundreds. A lot of the main global channels, Dr. Harvey has been making live appearances on, talking about this important topic of AI and healthcare. And he plays a crucial role there. He's sort of orchestrating the AI adoption plans, if I can talk about it in that context, bridging the gap between technology, healthcare, and also fostering the important collaboration with physicians and medical people. So as an ER physician and an AI and space tech futurist, you may see the Phantom Space Corporation logo behind him. I'm sure he'll tell us a little bit about that. But he's also helping leverage satellite lunar technology to predict disease on Earth. So fascinating stuff. And of course, Dr. Harvey, 4 times TED speaker, he's been on the stage many times, an advisor to the Singapore Ministry of Health, and of course, Phantom Space, as I mentioned. He's also an author, of course, on ChatGPT and healthcare. And I'd like to welcome Dr. GPT, Harvey Castro, MD, to the Think Global Forum Roundtable today. You're very welcome, Harvey.
Well, first of all, a sincere honor to be here, and a sincere thank you to everyone for your time. And I'm excited to say I'll be in Europe. I'll be in Copenhagen August 27th to like September 3rd or 4th. I'll be speaking out there. So if you're in Copenhagen, and maybe we can meet up. So thank you for having me. So we can jump in and
it's our pleasure. Yeah. Well, thank you to our panel. Thank you to everybody joining us. Now let's get the show on the road. Harvey, I'm going to hand over to you because you're going to take us through a presentation to whet the appetite and get us thinking about AI and where we are now and maybe where we're heading. So over to you, Dr. Harvey.
As a patient advocate, I'm excited about the potential of AI in healthcare. I enjoy following Dr. Castro on LinkedIn.
Accurate early disease detection, groundbreaking.
This technology promises a future where care is customized to each individual's unique health profile. Keep up the good work, Dr. Castro.
Yes, predictive diagnostics within reach.
Thanks to innovation in this field, personalized healthcare is becoming accessible to all. I'm happy to see that Dr. Castro wrote the first book on ChatGPT and healthcare back in 2022.
No more injuries undetected?
Hi, as an AI researcher, I collaborate with medical experts, like Dr. Castro, to develop technologies that predict health risks, personalize therapies, and support surgical procedures. Our aim is to leverage AI to not only improve health outcomes, but also to save lives.
VideoGen AI Medical Imaging Transformed.
The new iPhone 18 will leverage small language models.
And so we're in a healthcare crisis. Unfortunately, there's anywhere between 10 and 20 million Americans being misdiagnosed. To me, that's one too many. The fact that someone has a misdiagnosis and has been going to the doctor, and I'm going to give you some examples of that, to me, there's no excuse. We need to do something. And that something in my heart is let's leverage AI. We have a global shortage. As if we think about it, population's getting older and older. And unfortunately, people are wanting to retire, and I get it. But then as that gap gets bigger and bigger, we won't have enough people to take care of millions of people that we need to. There's a huge lack of access in healthcare. The other part is medical data, believe it or not, doubles every 72 days. Think about that. If it was the 1950s and I was going through medical school, medical knowledge would double every 50 years. So think about that. I could chill, take 10 years off, come back, nothing really has changed. I do that even like a month today, or let's just say I took 3 months off. To me, that would be almost malpractice because things have changed so much. Next slide, please. So why am I so passionate about this and why is there all this stuff going on? It's because there's simple applications that will really help me take care of the underserved population. I truly think it's going to help break down some of these barriers. Give you an example. A couple of months ago, I was at the border of Texas and Mexico, and they speak Spanglish, little English, little Spanish. And imagine being a doctor giving discharge instructions to a patient, and they don't understand what you're saying to them. Using AI to break down that barrier, to give them the discharge instruction in their language. And now with AI, being able to cover, right now there's over 54 languages, but depending what model you use, it could do it. And we'll go over the security and all that. So please play that first slide, the video.
No te preocupes, estoy aquí contigo. Juntos lograremos esto y pronto te sentirás mejor.
So what I did is I cloned my voice. Granted, this is old, so there's better models now, but that is my voice. Now, I do speak Spanish, but I was happy to hear that that's Spain Spanish, and it was really good, so kudos. Then I thought, I have children that I discharge, and I know when I discharge them, these kids aren't getting the discharge instructions. They're kids. They're not going to read it. And in fact, some of the parents of the kids are not reading the discharge instructions. And if they're having an issue, how can I convey for them what I'm trying to say? So big picture, I took the discharge instructions, put it into an AI, and then created a coloring book. And now the discharge instructions, it's a coloring book that I can use to color with the child. I also did the same for the comic strips as a discharge instruction. Let's play that next video. See, we have patients that are hard of hearing. And I thought, well, I don't know sign language, but now I can leverage AI to create sign language and convert my discharge instructions for sign language. Next slide. Now, I know I may be going a little fast, but I want to cover a bunch of stuff, and I want to make sure that we get through it. Now, I already mentioned this about doubling every 30 days, the misdiagnosis, and I really think AI is here, and it's going to help us. And we'll go over the negative, obviously. Next slide. So this is really dear to my heart. I did a TEDx talk, and this was basically part of it. But at the end of the day, this hits home to me. You see, my father died when I was in my early 20s of a heart attack, and he was young. And the part that breaks my heart is he literally died overnight. No warning signs. Nobody saw it coming. And literally, one day he is here, the next he's gone. I think about my mom, and she had 2 different types of cancers, and I almost lost my mom. But the reason I didn't lose my mom is because she's an ultrasound tech. She just happened to be scanning her thyroid, teaching someone how to do thyroid tests, and she found a nodule. It was early on. She went to the doctor, they scanned her, they found 2 different types of cancer, went through chemo, the whole 9 yards, and 20 plus years later, she's alive today. Next slide. And so I started thinking, what is the main difference? Why is my dad not here? And why is my mom here? And I started thinking, it's that difference. We have proactive medicine and we have reactive medicine. Think about how many times you've gone to the doctor, and do you go because of your checkup, or are you going because you're sick? See, as an ER doctor, I'm biased because I only see people at their worst. I'm not going there for preventive medicine because that's not the emergency room. But unfortunately, access to care, they can't see their family doctor. They come see me instead of their family doctor because they can't. Second, they're not being proactive. And I thought, man, if I'm able to use my wearables and this thing says, hey, Harvey, you didn't sleep. Hey, you really shouldn't work out this morning because you're going to actually do more damage than good. Then here's an example of that. Next slide. Now, I started thinking, what can AI do? You see, to me, I see it as a lighthouse. See, it's going to light up that path. Where do I need to go? And my favorite phrase is working backwards. So if there's things that are going on in healthcare, then how can I leverage AI to be able to give me that predictive analytics, to give me that diagnosis, to help me in my intervention with my patients? Next slide. So I'm really stoked about this because this stuff is crazy in my opinion. I don't think many of you guys know, but this camera feed, my voice, the video, both of those things, you can tell if I'm a pre-diabetic. In fact, my voice alone can tell you my blood pressure. And you're like, no freaking way. Yes, that's going to change the way telemedicine does things. Now, yes, there's some experiments and stuff like that, but that's going on. Another thing that I saw that I thought this is crazy technology is if you're a diabetic, you finger prick yourself, you say, okay, my sugar is X. And now your phone knows for the rest of the day, this is where you're at. But here's the fun part. As you're talking throughout the day, it's hearing your voice and it can fluctuate and say, oh, your sugar is this, it's that. Crazy. I mean, what a way of delivering healthcare. There's some breath tests out there that you can speak. I mean, it'll like smell your breath and it'll tell you if you have lung cancer. There's some AI diagnostics that, again, on your voice, it's saying, 3-4 years from now, this person's going to have Parkinson's disease. We can detect it. Then I started thinking, man, I travel a lot. What if they put one of these sensors that is detecting COVID or an outbreak, and now it's at the hospital level? I mean, sorry, it's at the hospital or it's at the airport, and now it's detecting, say, anthrax or certain diseases that are in the circulation of the air. Now the AI is saying, hey, we need to shut this hospital down. We need to stop all airplanes. What a way of saving lives. What a way of changing the world. My last quick example is my grandfather has macular degeneration. He can't see, but big picture, think of it as little blocks of blob that he can't see. He has to turn his head. But now I'm leveraging AI. I gave him some AI glasses, and he can take a picture of the chessboard when we play chess. He can take a picture of the environment. In fact, he can turn on the camera live, and there'll be a human on the other side being his eyes for him, giving him independence, leveraging AI. So I thought, man, this is what we need to do as a nation, as a country, as a world. Next slide, please. So obviously the human diagnosis, this is another sad part. It hit the news, I think 2 years ago, but the skinny is this. There's this mother, her son was about 3 years old, big picture. By the time he was 5, he couldn't walk anymore because he went undiagnosed. In fact, for 3 long years, no one could figure out what was wrong with this kid. Fast forward, the mom took there was like 17 doctors, all these consults, MRIs, CAT scan, put all that stuff into an AI. And within seconds, the AI said, we think this is tethered core syndrome. So she went back to the doctor, and the doctor's like, what's going on with my son? AI is telling me it's this. And he's like, well, I don't think it is, but let me look through the films again. And they're like, oh my God, I see it now. So he had surgery. He's alive and well. And I thought, man, this is not isolated. I'm seeing these stories every week that people are doing this, and there's good and bad to it, but we'll go over that. Next slide. Now, I'm going to fly through these next ones, but there's a big thing right now with AI mammographies. Mammography is a way of screening for breast cancer. And so think of it this way. You go to the doctor, you do your mammography, the doctor analyzes the mammography, says you don't have breast cancer or early stage breast cancer, because it's a screening test. But what they've done is they found an AI, and this is a true case, where the individual went through, the human read the mammography, said there's no concern, the AI found some small subtleties that says, you know what, we need to biopsy this. This doesn't look normal. She came back, got a biopsy, and yes, it was early stage breast cancer. And I thought, man, again, I've heard the same story over and over because yes, my favorite phrase is we don't know what we don't know. And as we get older, we can't see what we can't see because we're getting older. And there's things that happen. But the AI is there 24/7 and it's been trained, but sometimes hundreds of thousands of millions of other cases that's able to see things that we haven't. When I started thinking about this things about genetics and how can we leverage, I mean, we're not far from the day where I can take your genetics and create what you look like a digital twin, and then give you certain medications virtually, and then say, okay, this one worked well, this one didn't, and then I can customize. See, we have all these people who are listening, but why as a doctor, though I treat all you guys pretty much the same, I tweak the dose here and there, but not much. Why not create a personalized medicine that is specific to your DNA, to you, and be proactive? Like my example of my grandfather, you see, there's this thing called CRISPR, think of a gene therapy. And I used AI, I created an agent that went through the internet and found all the clinical trials, what vitamins works, what not, what pills, what's the latest. And then I knew my grandfather's not going to do that. And so I know since I have the same gene, my mom, by inference, should have it as well. And so I called my mom and I said, you know what, I'm going to have this AI create a website. And so it did a search, it created it, it made a website, and I said, hey, mom, take a look at this. Here's all the clinical trials I want you to take a look at so that you one day can still have your vision. So I'm leveraging, again, AI. Next slide. So James was another one that was interesting. I really believe that these monitors will make a difference. And I know there's some false positive, but basically James was a runner. The watch was able to tell the patient, you have early AFib or have AFib, went to the cardiologist, they checked, and they're like, yeah, you do have AFib. Again, there's so many things that are deadly that we don't know. And again, I'll say it again, we don't know what we don't know. But if these things can start shedding light or something and we can make a difference, then God, now we just saved a life. In fact, one of my close friends, I was literally walking on stage to give a talk about this particular topic in this example. And as I'm walking on stage, my friend texts me saying, hey, I'm an anesthesiologist. My heart went into this weird rhythm. I didn't feel it. I ended up going to the ER. They zapped me, and then he had a cardiac ablation. And I'm like, oh my gosh. Again, the watch told him. And I thought, you see, and he's a doctor. He should know better. But he didn't see or feel any signs. And I thought, man, this is changing the world. Next slide. Now, for me, people ask me, what is the most surprising, impactful AI breakthrough that you've seen? See, that's a hard question for me. I feel like from a physician, I feel like I have all these tools now that I can do more things. For example, a prototype I'm working on is a plushie that has AI, has NFC technology, so that if a kid that has cancer is going through the hospital, this thing will tell them, hey, you're walking into an MRI. It has his favorite voice. I'm looking at it with that perspective. How can I help my patients? On the industry side, I'm thinking, man, drug discovery, huge AI agents to go and find out what do these molecules look like and create drugs. AI is able to bring down the cost from $1 billion to $2 to develop a medication to 100 million to $2. I mean, think about that. Next slide. Now, what is keeping me up at night literally is if this is not used correct. You see, when I speak to doctors, I am fine. I'm telling them what to do, not to do, because at the end of the day, they have a license to be a doctor and they know better. Parts that would worry me there is when patients use it because, again, they don't know what they don't know. So if the AI says X and they're in a country that they can go to a pharmacy and get a medication, that worries me. Because what if they don't have the disease? What if they're self-medicating themselves and now they're actually hurting themselves? So that's something that truly worries me. The next slide. Now, for me, I personally had a near-death experience. I've probably this is like the second time I talk about it. Right after I graduated residency, I started having migraines. Nobody could figure out what was wrong with me. I had MRIs, LPs, CAT scans, you name it, specialists, nobody could figure it out. So they gave me a pill to basically prevent any migraines. If I felt it coming, I would take it and it would stop it. That medication, unfortunately, gave me a dystonic reaction to the point where I was paralyzed on the left side. I couldn't speak. I was in the ICU for a week. And I thought, man, if I had AI back then, I would have looked at it and said, oh my gosh, there is a contraindication here for me. I shouldn't be on this medicine. And that would have saved me. And I really thought I would never practice medicine. In fact, I just graduated, and this happened 1 month after graduation of being in the ER. And it's just really broke me. So I start seeing the other problem, again, is the data gap. You know, we're helping people and we realize, you know, some of this data is skewed. It's only a particular patient. It's only a particular type of population. What about the other populations? And so when I see that gap, I'm like, man, we need something. We need to create the data that's missing here so that these algorithms serves everyone around the world. Next slide. So we talk about the training data inequality. I jokingly saying, I'm not joking. I was like, we need somebody like a billionaire to help fund the research. So we're addressing these populations so that gap lessens. And so we're able to address. I'm really worried that if we're not careful with this technology, it's going to make the gaps worse. Literally in May, I was speaking in Germany, and it dawned on me. I was the keynote speaker for a dermatology conference, and it really hit me hard when I realized when I went through medical school, all my textbooks had a certain population of people, and all the rashes that I memorized was a certain population color of people. And I thought, this makes sense why some of the AI is getting it wrong with different ethnics and different disparities of people, because it never saw it. And so it's not that it's being racist or biased, it's just it never saw it. So how could it know something that it's never seen? And I thought, man, we really need to do better with these training sets, because if I went through it in med school and AI is having the same, then we're going to start seeing this. And again, we don't know what we don't know, but it's me as a doctor, I'm able to educate other doctors how to see this and how to fix it. So now they know that when they're dealing with AI X, that it has Y disease or Y problem, and not to use it that way. I really want to advocate for a kind of like a food label in AI. So every time you grab a different AI, it tells you for your specialty how it could be good and why it's wrong and what data sets are missing. Next slide. And so I'm down to the last minute. You know, at the end of the day, I look at this and I'm like, simple things. Why are doctors scared of this in a way? Well, it's a bell curve. If I'm in California and Silicon Valley, people are literally giving me high fives, hugs, like, let's go. If I'm in some parts of the United States, they'll give me hard looks. They're like, no, this is the devil. We don't want this. And so I'm having to explain this black box and say, look, this is how AI got to this problem. Here is how AI got from A to B to C. And when I show them the mind maps, when I show them certain algorithms and they see how it works, they're more likely to do it. People ask me all the time, Harvey, how do you use this? And how can you get them to use it? And we'll go into Q&A, but I tell them, do not show them the limousine. Show them something simple that they'll want to use. Hit the play this video for me, please.
Medicine, every choice shapes reality. Stay in the past or embrace AI-driven care. Dr. GPT is the reality override.
I was just having fun, guys, so I had to show it. Next slide. And so at the end of the day, what is the framework for AI? I think we need to make sure that we're compassionate how we do this. I truly think this access can't be for the rich or the poor. It's got to be for everyone around the world, regardless. We need to treat AI with respect and really understand how this works. And as we start implementing it, we must implement this ethically. Next slide. And everybody gets a copy of this. One of my favorite things people ask me is like, hey, Harvey, who should I follow? And I'm like, dude, I'm going to tell you what people told me when I was in high school. Follow someone conservative, someone liberal, and possibly something like in the middle, because then you'll find something there so that you decide. And so somebody made this slide for me, and I've been using it ever since. And they think I'm kind of in the middle where I'm actually I'm realistic, but I'm also optimistic. So take a copy of this. We'll give you a copy and just follow different people so you can get your education on AI and healthcare. Next slide. And so the last thing I want to say is if you go to my website, hit that little arrow, and there's that little chat bot on the right. You can go to my website. I have about 27 books on there, and then it's a RAG model. Basically, you can just talk to me. So all my books, all my knowledge is there, and then you literally can have a conversation with me. It's kind of fun, geeky. I've had it for a while. Thank you so much for your time, everybody.
Thank you very much indeed, Dr. Harvey. That was very insightful, certainly whetted the appetite for our panel discussion coming up next. Following the panel discussion, of course, we'll have a Q&A. Thank you to people who've already submitted questions. I'll be getting to as many of those as I can towards the end of our time here today. María, Mateos, I want to come to you first, just to get any thoughts you've got on Harvey's presentation. And I also want to go back to what he touched on towards the end of his presentation with yourself in particular, because we often hear about LLMs and AI, we're all hearing about it constantly, but a lot of their success comes down to the quality of the training data and things like rare diseases that you touched on, where there's maybe less data, or languages for certain communities which are less accurate and not maybe as necessarily linguistically correct as they need to be in terms of training the AI. But María, Mateos, that's over to you. What are your thoughts on what we've been discussing so far? And maybe a little bit on where the data's missing a little bit?
Yeah, well, I'd like to start by thanking Dr. Harvey here for such a powerful presentation. This is a life-changing topic, really. AI can help shift healthcare from reacting to problems to actually preventing them. I think that's key, that's life-changing. And as he said, especially for patients who don't usually have access to early care, this is truly fascinating. But to your point, Simon, when it comes to rare diseases, that's a fascinating parallelism that you have established, right? Just as AI translation models struggle with low resource languages, we see it and we do our best to prevent it and help on that way. There's really limited training data there. AI in healthcare, I guess, faces similar struggles with rare diseases because there's lack of information, lack of data. Those zebras, as we call them, suffer from that. There is very little information. Those diseases are complicated to be diagnosed. In language translation, for example, we are seeing solutions like transfer learning, where models are trained and adapted to low resource languages, for example. So I guess a similar approach can be taken in healthcare. And please, Jamie, Harvey, correct me if I'm wrong here.
No, you're right. I know there's a lot of fear out there, and I want to say this, and I want everybody to really self-reflect. It's about human plus AI. It's about you, how your brain works, your creativity, and how you're molding things, and then leverage AI, and then putting it together. The reason I'm able to do this, I have 20 years ER experience. I'm a business owner. I've created my own hospital system and all that stuff, and also I've been really studying my butt off when it comes to AI, like hard the last couple of years. And so when you put it all together, it just makes sense to me. But it's my personality, that plushy idea, all this like ideas, it's just that. And so I'm going to encourage you, whatever problem you're facing, look at it without the AI, see how you would figure it out, and then add the AI. And I really feel you're going to start seeing some interesting permutations.
Hey, thank you. And thank you, María, for your thoughts. Jamie, I'm going to come to you. Any initial thoughts? Because I have a question for you as well, but maybe your initial thoughts.
Yeah, I think, and Dr. Harvey, thank you for the presentation. I think if I reflect on my experience in the UK and what the healthcare system is doing here, which I think is probably quite well publicised globally in terms of some of the challenges that we have that are very similar to what Harvey outlined. AI, to me, and builds on what Harvey just said, is the accelerant. It's what takes and allows us to shift the speed of the healthcare system. And in the UK, we're talking about 3 major shifts to continue to embrace the system that is free at the point of care for all of our citizens, to ensure that it's equitable and useful. And all of those are enabled by AI, by technology, by the responsible use of that in the environment. And quite frankly, without that tech, those shifts wouldn't be possible. And the aging population, the workforce shortages, we would have real challenges in terms of how we're going to get over those, both as a country in the UK, but I think these are global challenges, and I think the role that AI's got is genuinely going to start to solve challenges that exist in healthcare systems around the world, particularly where there is inequity in care, in being able to make care more equitable across a population.
Thank you, Jamie. And Jamie, I want to come back to you as well on a question, because we often hear, maybe not so much these days, but we heard for many years in Silicon Valley. Harvey was mentioning in California, he's getting high fives. In other parts of the world, maybe he's getting a few stares. But we used to hear about move fast and break things, and not necessarily that holds true, but it doesn't really apply. There's sort of a contradiction between fast tech and getting things done, and then the AI and healthcare world, because what breaks in healthcare, it isn't a UI, for example, it's a person, it's us. So what can be done from your perspective, because I know you're in this line of work, is there anything we can do to help the implementation of new technologies, even though there's risks, even though there's challenges? Even implementing AI and workflows in some parts of the world seems to be going ahead really fast. In other parts, it's almost at a standstill because of the risks and the fear. What do you see from a technology implementation perspective, Jamie?
I think it's a spectrum. Netcompany, we've been, our strapline is we've been responsibly digitalizing Europe for the last 25 years. Responsible, I think, is the right word to use around AI, and it's using it in a proportionate way. So it's looking at the benefits, the risks of that particular solution, and the outcomes from it. Clearly, in a scenario where there is, the risk of harm to an individual, you have got to be more tempered with how much you might try and how much you might use. But when I look at the appetite to the use of AI in healthcare settings, we're seeing lots of use in terms of enabling clinician productivity, ambient voice, taking notes, synthesizing those notes. That actually is quite risk proportionate. There's unlikely to cause harm as a result of that. Clearly, when we're getting into the wearables technology, augmenting that with human decision making and understanding of the broader impact and ensuring that those biases aren't there in the AI is really important. I think we're some way off AI making full-on diagnoses without human intervention, and I don't know that we would ever get there, because I'm not sure that that's something that we would anyone would necessarily be advocating for, because I think you do want that human element of validation. But as a decision support tool, as an automation tool, as a productivity saver, there's lots of use cases. It's using it in a risk proportionate way.
Yeah, thank you. It's great points. And María, Mateos, back to you. And I've talked a little bit there about the technology implementations and some of the challenges there Jamie was just speaking about, and where things are moving. What about from a language and a content perspective? Because you're dealing with global organizations in the healthcare space when it comes to their global content. What are the type of things that people are coming to you for more and more, which is being impacted by the requirement to communicate with people in their language?
Well, that's a very good question, Simon. And for, let's say, European languages, for example, we have a lot of resources and training is huge. But for low resources languages, for example, as we spoke before in relation to rare diseases and everything, it's not just about translation, but I would say the medical terminology, the cultural nuances, those are the tricky parts. That's where the multilingual models need to be trained by humans. You need humans in the loop in that workflow. You need that human validation. That becomes essential, I would say. because otherwise we risk creating a lot of problems in the workflow, and mistranslations may lead to terrible mistakes. And as we've been saying, people's lives are at stake, right?
Right. Yeah, it's a great point that you make, and thank you for sharing that. I think Dr. Harvey was also talking about that when he was saying it's AI plus human, right? That's what we have to get into our mindset. And just carrying on the technology theme a little bit, if I can, there is no MVP, if I can use that term, for patient safety, right? It doesn't exist. Cutting corners early in this space might mean that you're definitely trusted less later. And am I right in saying, this is open question to the panel, whoever wants to jump in, that in healthcare, we kind of have a process where you have to build the airplane before you take off. Whereas in tech startups, it's sometimes the opposite way around. You sort of take off and then you're building the plane in flight. Is there a better way here? Are there certain areas we should be tackling first? What are your thoughts on that? It's an open question for whoever wants to jump in on that.
Yeah, I'll jump in first. I truly think it takes a village, right? I literally saw a post, I think I saw you comment on it, and they had basically a Venn diagram, and it showed the different ways that AI could be used. But when you looked at it from 10,000 feet high away, you would notice that they didn't really have a focus on the patient. And I thought, oh my gosh. So when we're creating, don't just include the C-suite that's going to pay for it. Don't just include the doctors, include the clerk, include the nurses, but more importantly, include the patient. Because my favorite phrase is, let's work backwards. What is the problem? Let's create our team. Let's even add ethicists into it. And then let's collectively work on it and then make the model. Because yes, maybe that takes a little time, but you're going to create the right thing. Quick example. If the C-suite wants to fix X, but the doctor that's taking care of patient wants Y, and then either one of them creates something without the other, it's not going to happen. But if they all could get together, maybe the patient's like, no, these two things, we really need X instead of those two.
Yeah, it's a great point. Anybody else? María, Jamie, do you want to chip in at all? Or will
I can jump in. I loved the analogy, Simon. So I guess in healthcare, we must build the plane before we take off, really. But it should be a collaboration, right? The right team, the right engineers, and the right passengers. The patient is in the center. We don't want them aside of the picture. They need to trust the system because healthcare is a trust-based system. And so, yeah, safety first, both for airplanes and for healthcare. But as Harvey was saying, that this doesn't mean it should be slow. It means that it needs to be built smartly and with validation in the process.
That makes sense. Thank you, María. And I want to move on. I've got some questions from the audience, and I've got one from Larry, which I think is certainly worth exploring. And Larry says there's very little awareness on how the AI is using our health data for LLM training. Maybe it's a bit back to that black box approach. You know, how is AI using our health data for LLM training, drug discovery, and health management? And Larry's question is, how do we control how our data can be used, stored, transferred? He mentions 23andMe. I think we're all familiar with that. Will the new owners use existing DNA without consent? Should governments be regulating more this form of personal health data? It's a great question. Anybody?
I'll start
You're
on that
give
one.
It a go, Jamie. Thanks.
I think there is a big regulatory challenge there. It's something that I know the UK is starting to grapple with. Yeah, I think there's clearly a distinction between personal health data and kind of anonymized health data. And the most important thing, I think, is that we understand how those models are less of a black box, and how we start to validate the decisions that they're making and making sure that there's no bias in those decisions, and that they aren't hallucinating, which can be done by utilizing multiple kind of LLMs and different models to test and validate the outcomes. But I think regulation has a role to play here, and I think that's where policy making has got to probably catch up a little bit with the tech that's available and how that can work for the public good, because ultimately this is about making a global population change in terms of the way that we're understanding that data, we're using that data, and we're using that to help everyone else globally.
Great
And
point.
I'll jump in and say, the way I see it in my mind, I see it in three pieces. We got the GDPR saying, here's what we think. We got California saying, here's what we think. And then we got the United States saying, here's what we think. And so where's the truth? That's where I struggle, because on one side, as a doctor, as a humanist, I want to see this advance to the point where it's going to save lives and make a difference and give people good quality of life. But on the other side, I don't want to see this used where it's hurting people and all these horrible things that can happen. So I get that dichotomy, and that's why I want to see what Europe leads with and what California does, and then see how it all can be best for our patients.
I'm going to jump in and add something there, if I may. I think a game changer here will be the EU AI Act that treats most healthcare AI as high risk. And as you said, Harvey, it aligns with MDR and GDPR to enforce safety, privacy, and I guess it was transparency, the last one. So that will be a life-changing too.
Agree.
All great points. I got a good question here from VJ in our audience. He obviously makes the observation that promises and use cases are very compelling. They're clearly compelling, he says, but can you speak to how oversight and review works to compensate for model errors? So gaps and completeness in underlying data, etc. So for the AI model or the patient. So what about where there's errors, or we need to compensate for model errors, the gaps, the lack of completeness here?
Yeah, I'll start with saying that's kind of why I started hinting that we need that food label analogy that I said. Again, I'm going to repeat it. We don't know what we don't know, right? But if a food label, let's say, is an AI that tells me, hey, Dr. Castro, don't use it on this type of person, this sex, this population, and it works great with this, then I'm like, oh, okay, then I can do it. And then when it's like, well, you're neglecting all these people. No. I'm looking at that and I'm saying, okay, we need to increase our data sets on X, Y, and Z so that we can really now give it to everyone.
It's understanding the context in which it should be used, how it should be used, and the potential risks and benefits of that use, and being able to make that informed decision as a professional clinician, I suppose, or as a patient wanting to accept that to be used for me or not.
Constanza has a question. On the topic of AI and diagnosis, are there any success stories of AI developing diagnostic scoring, or is that not tapped yet?
No, I'll jump in. There's so much stuff. I literally have an AI agent surf the web every day and then give me reports every morning so I can kind of try to somewhat keep up. But there are some studies, I'll give it the specific to ER. There are some AI studies that are looking at sepsis when someone gets really sick and they need antibiotics a certain amount of time. And if they don't get it, well, the AI is giving them even more time to catch it way sooner. And literally yesterday, I was speaking to a hospital administrator and he was like, yeah, we're getting great outcomes. We literally have this AI agent in the emergency room. And he says they're using it more in the actual hospital than in the emergency room, but he says all the ER doctors are using it and they are seeing way better outcomes. And I thought from an ethical point of view, think about this. If this thing is literally saving lives and changing the difference, then when will it become the standard of care where everyone in the country has that, or everyone in the world? And so really interesting.
Yeah, very good. We've got a great question here from Ravi. I'm trying to fit as many as I can in. Ravi says, when AI is, I think this is a great question, particularly for you, Dr. Harvey, but interested in anybody else's thoughts on this, of course. when AIs are getting superior to physicians, if not already, in the next 2 to 3 years, how do you think the scenario is going to change? Dr. Castro mentioned about human and AI collaboration, and that holds for now. But when these systems are so much better, how does that flip even happen? It's a great question.
Oh gosh, I been worried about this day, and it's getting here a lot sooner than I thought it would, unfortunately, or fortunately, depending how you see it. Here's what it's going to happen. You're right. At the end of the day, again, there's all of medicine. There's different verticals and there's different pockets, and there are some pockets where it's going to beat the human. I'll call myself out. 2 in the morning, I'm exhausted. I'm a human. I may not be thinking quick, but if I have the AI say, "Hey, Harvey, you forgot X. Hey, you didn't check the patient's heart." It's like, "Oh crap, thank you." And so at what point, to answer your question, does it become where I really need to like step back and let the AI? And I'm looking at some of these models that are being released. I really think I have high hopes for ChatGPT 5. I think there's going to be a point where, yes, it is better than a human. Yes, it could do certain things, but the cost is so high that the hospital and some companies won't use it. But from an ethical point of view, it's like we need to. And so here's my prediction. Unfortunately, I think we're going to start seeing some cases around the world. People around the world are going to be like, "Hey, country A is doing it. Why can't we do that here?" And there's going to be a lot of internal pressure. In the United States, with the GDPR taking so much money out from healthcare, there's a big stress on the economy. They're like, "We need to do something." And I really think that the government's going to start saying, "You know what, doctors and we're not going to make that money anymore. We're going to put it into this." And here's my case. Here's my prediction. We will see a lawsuit where hospital A used AI and hospital B across the street didn't, and that person had a better outcome, and then the lawyers are going to sue, and overnight we're going to see a whole industry change because of that one AI example. And then what's going to end up happening is when all these AIs are being used, no one's talking about the electric bill. No one's talking about what's going to happen there. So it's going to be really interesting.
Yeah, there's an awful lot of discussion going on in terms of GPUs and the power discussion right now. It's a great point. And there's another sort of question that touches on some of the things you were saying there. Maybe Jamie, you might have some insights on this, but it's from our audience again, are there countries or certain areas that are ahead in this digital transformation to include more AI in their healthcare management from that digital transformation perspective, I suppose? And the audience member says, "Look, I'm thinking maybe Japan. Is it the UAE? Is it South Korea? Is it Singapore? What's ahead at the moment? Like if you were looking around the globe."
So from my perspective, and I'm not sure I want to point to a particular country, but if I go back to an earlier point that the AI is only as good as the data that it sits upon. So I think those countries like Denmark, where Netcompany was founded, that have embraced digitalization, and that does include then your Singapores and some of your newer countries that have got a genuine digitalized healthcare system. It's far easier for AI to thrive and exist on that foundation of strong clinical population data that is then able to be exploited by the AI systems. I think those geographies, which I would include the UK within, that have struggled on that journey in terms of bringing that body of data together, are going to, are lagging behind in other geographies. I don't know, Harvey, whether you've got a sense on where you think would be more advanced at the moment.
Yeah, so I'm going to biasly say, since I'm an advisor for the country of Singapore, I get to see some stuff and research some stuff. And I'm biased when I say, when I'm seeing them present and I'm seeing some of the algorithms and what they're doing, I'm like, wow, they're very ahead of the time. And it's a blessing for me being in the United States because I'm seeing what they're doing. And I'm like, we're going to be here in about 10 years. So now I can try to figure out how I can implement that here in the US. Give you some real examples. I don't know about Europe if they have this, but when I was in Singapore, I was shocked when I saw that you could go to a vending machine, have a telemedicine visit, and then it drops your medication right from the visit. I was like, whoa. I was like, that is cool. I thought, what a way of access to care. Africa, I saw this. They have a drone that literally one of the biggest problems with medications is obviously they expire. Nobody's using XYZ, right? So all this wasted medication, they can't afford it. So here's what this country did. And don't ask me the name of it because I already forgot the name of it, but here's what they're doing. It's a centralized hub. It's keeping an eye on all the pharmacies. And when it knows that a particular one is low on stock, it literally sends a drone, drops off the medicine, and then it fills the pharmacy. And that's what they're doing for the entire country. I thought, oh my God, what a way of maximizing your resources. Brilliant. And then the last thing I want to say about Singapore, I know there's going to be some really ethics heavy stuff. You're like, whoa, Harvey, that's messed up. But let me tell you what they're doing. They have the DNA of every single Singapore citizen. And you're like, oh, that's too much information for them to have. Granted, they have the retinal scans of every single individual. But here's what they're doing. They're scanning for hypercholesterolemia patients that are having a heart attack in their 20s. They know their genetics, and they're putting them on medication in their teens so that they don't have a heart attack and die in their 20s. And I thought, wow, like talk about being proactive, talk about helping them, not waiting till they're on their deathbed. I think that is what I'm happy to see.
Yeah, incredible, incredible. Well, look, I could answer. We could be asking questions all day here. I wish we had more time, but I want to move on if I can. Thank you to everybody who submitted a question. I'm sorry if we didn't get to everybody. We'll do our best to answer them at a later stage. We'll get back to you. But I want to move on because we're coming to the end here, and I want to ask each of our panel members to give us some final thoughts, maybe some key takeaways, or maybe just some point we haven't touched on that you also want to mention. I'm going to go around the table. María, Mateos, I'm going to start with you. Sorry to put you on the spot, but what are your
first,
parting,
I guess?
yeah, what are your parting thoughts from today's discussion? Anything you want to leave us with?
Well, my mind is blown, really. The potential here is huge. I guess not just for advancing technologies, but for transforming the patient's care, the patient's journey in a truly meaningful way. Keeping the patient at the center, the African example Harvey shared is fantastic. Keeping that patient at the heart of the research and the technology advancement is just fantastic. I'm really optimistic about this, about everything that's coming. And I believe that in the future, since we were talking about the future and what other countries are doing, I guess the trend would be moving from what today is experimental becoming essential in several areas in healthcare. So I think that's fantastic. And thank you. I'm very, very grateful and honored to be part of this conversation that really shapes the future of healthcare.
Thank you, María. Great final thoughts. Jamie, I'm going to come to you, sir. What are your final thoughts? Anything we haven't touched on, or any observations about our discussions today?
Yeah, I think we've had a very wide-ranging set of discussions. I guess what my main reflections are is to Maria's point, the future of healthcare. I think what we're looking at in some geographies is the future is already here. We've got these technologies in play in some of the more developed countries, and some of those technologies that are going to really propel healthcare forward are probably existing today in small proof of concepts, in small examples within individual hospitals and such like. And I think what we've got to do is we've got to be brave. We've got to be responsible, and we've got to be risk proportionate in our approach to the adoption of AI. But what we can't do is say it's not going to happen. It is happening, and it is going to genuinely radically shift the way that health is delivered, and shift us to a much more preventative healthcare system, which is good for payers, it's good for governments, it's good for the population. And I think we've got to be open-minded, and we've got to think about the benefits that this brings to each and every one of us.
Oh, great last thoughts. Thank you for summarizing that for us, Jamie. And Harvey, it's left with you to give us the final thoughts before we close out today. What are your final thoughts, Harvey? Anything you want to leave us with?
Yeah, at the end of the day, I want you guys to have fun with AI. If you saw my slides, I'm making fun of myself, videos. Yes, it's scary, but it takes a village. be part of this village. Come to these talks that he's doing. Great job. Make sure you follow people. I put my LinkedIn in the comments, and feel free to follow me. And the more we learn, the more, and I'll say it again, we don't know what we don't know. So the more we learn about this topic, it's not going away. It's going to be more and more part of our lives. So it's really important. So with that, I just want to say thank you sincerely for having me. It's a sincere honor to be with these amazing panel. And thank you, guys.
Thank you, Dr. Harvey. And I just want to thank everybody who's joined us live around the world. It's been great to have you with us. Thank you for the great questions and insights. And a quick reminder from me, head over to the Think Global Forum. It's at thinkglobalforum.org. Join us on the newsletter community. Get involved. We run in-person events and these virtual roundtable discussions where we cover some really interesting topics. And finally, I just want to thank María Mateos from Vistatec Life Sciences, Jamie Whysall from Netcompany, and of course, Dr. GPT himself, Dr. Harvey Castro. Thank you, everybody. It's been great. Thanks for joining us today, and we'll see you again soon on the Think Global Forum. Goodbye, everybody.